Welcome to our next video on a series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. We are now in week 11 of Maddie's post-op progression. Remember, in phase 3 of this process, we want to get her comfortable with distance running, increase the intensity to include sprinting, work on pivoting, cutting, and jumping. And if you remember last week, we had some joint line tenderness, so we shut her down for a few days to let her recover. Now, we reassessed her at the start of the session and she no longer had any joint line pain. There was no positive or no pain with McMurray's. So we put her back on the treadmill to resume the walk-jog interval we had tried the week previously. We were actually able to progress her to a faster speed and increase the intensity while she was working on landing softly with her feet and minimizing the impact to her joints when she was landing. We then took her out onto the field and did some light jogging at a comfortable speed, just going 10 or 15 yards at a time. And the change of surface not only added a proprioceptive element, but it's also different because running on the treadmill actually pulls you along. Well, when you're running on the ground or on the turf, you actually have to propel yourself forward. Through all of this, we've wanted to maintain a good strength base. We focus more and more on single leg activities to make sure she has symmetrical strength. We did some more on the shuttle, which uses an elastic resistance, so you get concentric and eccentric. And we worked on some eccentric quads, doing step downs and other activities like are seen here. Now, her knee control has improved, but typically what I would see is her first couple repetitions were a little wobbly, and then they improved after that. We also had her start doing some full range deep squat activities to work into that end range motion, as well as make sure that she was symmetrical coming down and she was working through, favoring that left side. When we had her doing some lunges on the TRXs seen here, she was able to maintain a much better upright posture, showing that her hip flexors had begun to stretch out, and she had much better knee control and positioning with her surgical leg, whether it was in the front or the back. Now, this wasn't quite as good when she was doing it without support on the turf, but overall it was much better. Here you see her doing some box drills, which is like a sprinting activity where we have them go for 20 seconds, working on landing with light feet and driving the arms. We also had her do some controlled jumps on the TRX, working on the explosion phase up as well as the eccentric load on the way down. And we combine that with some deep squats to work on the knee control during these transitions, and combine later from a deep squat to a jump and then back down to a landing. For field drills, we progressed to a lateral bounding seen here. This involves an eccentric loading of the quads as well as a knee control and balance. We did it on the turf as it's a little more challenging than the floor. For ball work, we had her do more dribbling and shooting as is seen here, with the lift of the wall kicking the ball back in an unpredictable way she would have to react to. Now, we also had her do more juggling. In fact, we tried to get her to think about how many touches she could hit the ball consecutively, or how long she could keep the ball in the air, whether she had to dribble with her feet, her thighs, chest, head, whatever body part that was legal for her to use in soccer, so she can keep the ball in continuous motion. In week 12, we want to work on acceleration and sprinting, and progress the functional activities for cutting as tolerated.